Are you struggling with anxiety? If so, you're not alone. Anxiety disorders affect millions of people worldwide, and finding the right treatment can make all the difference in improving your quality of life. Two common medications prescribed for anxiety disorders are Alprazolam and Lorazepam. In this video, we will delve into the differences between these two anxiolytics and explore their effectiveness in managing anxiety. Understanding anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive and persistent worry, fear, and apprehension. These disorders can significantly impact daily functioning and overall well-being. Generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias are some common types of anxiety disorders. The exact cause of anxiety disorders is not fully understood, but a combination of biological, genetic, and environmental factors is believed to contribute to their development. Symptoms can vary from person to person but often include restlessness, irritability, difficulty concentrating, muscle tension, and sleep disturbances. Overview of anxiolytics. Anxiolytics are medications specifically designed to alleviate anxiety symptoms. They work by targeting the brain's neurotransmitters to reduce excessive neuronal activity and promote a sense of calmness. Alprazolam and Lorazepam are both benzodiazepines, a class of anxiolytic drugs widely prescribed for anxiety disorders. Benzodiazepines enhance the effects of a neurotransmitter in the brain called gamma-aminobutyric acid, GABA. GABA acts as an inhibitory neurotransmitter, meaning it reduces the activity of neurons in the brain. By increasing GABA's effects, benzodiazepines help to decrease excessive neuronal firing associated with anxiety. Alprazolam, mechanism of action and uses. Alprazolam, commonly known by the brand name Xanax, is a benzodiazepine that is widely prescribed for anxiety disorders. It is available in immediate release and extended release formulations. Alprazolam works by binding to specific receptors in the brain, enhancing the effects of GABA, and producing a calming effect. Alprazolam is primarily used for the short-term management of anxiety disorders, panic disorder, and anxiety associated with depression. It can provide rapid relief of symptoms, making it particularly useful in situations where immediate anxiety relief is needed. However, due to its potential for misuse and dependence, alprazolam is typically prescribed for short durations. Some common side effects of alprazolam include drowsiness, dizziness, confusion, and impaired coordination. Long-term use of alprazolam can lead to physical and psychological dependence, making it important to use the medication as prescribed and under the guidance of a healthcare professional. Lorazepam, mechanism of action and uses. Lorazepam, often prescribed as Ativan, is another benzodiazepine used in the management of anxiety disorders. Like alprazolam, lorazepam works by enhancing the effects of GABA in the brain, resulting in a calming effect. However, lorazepam has a slightly different pharmacokinetic profile compared to alprazolam. Lorazepam is available in both oral and injectable forms, making it suitable for various clinical situations. It is commonly used for the short-term management of anxiety disorders, panic disorder, and as a premedication before surgeries or medical procedures. The injectable form of lorazepam is often used in emergency settings to treat acute anxiety or agitation. The side effects of lorazepam are similar to those of alprazolam and other benzodiazepines. Drowsiness, sedation, dizziness, and coordination difficulties are commonly reported. Like alprazolam, long-term use of lorazepam can lead to dependence, so it should be used cautiously and as prescribed. Efficacy and effectiveness of alprazolam and lorazepam in anxiety disorders. Both alprazolam and lorazepam have demonstrated efficacy in the management of anxiety disorders. Studies have shown that these medications can effectively reduce anxiety symptoms, improve quality of life, and increase overall functioning in individuals with anxiety disorders. However, the choice between alprazolam and lorazepam depends on various factors, including the specific type of anxiety disorder, individual patient characteristics, and treatment goals. Some studies suggest that alprazolam may be more effective in treating panic disorder, while lorazepam may be more suitable for generalized anxiety disorder. It is important to note that benzodiazepines, including alprazolam and lorazepam, are generally recommended for short-term use due to the risk of dependence and potential for abuse. They should be used as part of a comprehensive treatment plan that includes therapy and lifestyle modifications. Side effects and risks of alprazolam and lorazepam. Like any medication, alprazolam and lorazepam can cause side effects and carry certain risks. Common side effects include drowsiness, dizziness, sedation, impaired coordination, and memory problems. These side effects are more likely to occur at higher doses or with prolonged use. In some cases, benzodiazepines can cause paradoxical reactions, leading to increased anxiety, agitation, irritability, or aggression. These reactions are more common in children, older adults, and individuals with a history of substance abuse or mental health conditions. Another significant risk associated with benzodiazepines is the potential for dependence and withdrawal symptoms. Abrupt discontinuation of these medications can lead to withdrawal symptoms such as rebound anxiety, insomnia, restlessness, and even seizures. It is crucial to taper off benzodiazepines gradually under medical supervision to minimize these risks. Choosing between Alprazolam and Lorazepam for anxiety management. The decision between Alprazolam and Lorazepam should be made in consultation with a healthcare professional who can assess your specific needs and circumstances. Factors such as the type and severity of your anxiety disorder, medical history, potential drug interactions, and individual response to medications should be considered. Alprazolam may be preferred when immediate relief of anxiety symptoms is required or when treating panic disorder. Lorazepam, on the other hand, may be more suitable for generalized anxiety disorder or as a premedication before medical procedures. It is essential to start with the lowest effective dose and closely monitor your response to the medication. Alternative treatment options for anxiety disorders. While benzodiazepines can be effective in managing anxiety disorders, they are not the only treatment option available. Other medications, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed for long-term anxiety management. Psychotherapy, including cognitive behavioral therapy, CBT, can also be highly beneficial in treating anxiety disorders. CBT helps individuals identify and change negative thought patterns and behaviors associated with anxiety, leading to long-term symptom relief and improved coping skills. Lifestyle modifications, such as regular exercise, healthy eating, stress management techniques, and good sleep hygiene, can also play a significant role in reducing anxiety symptoms. These approaches can be used alone or in combination with medication and therapy, depending on the severity and individual preferences. Precautions and considerations when using anxiolytics. When using anxiolytic medications like Alprazolam and Lorazepam, it is important to follow the prescribed dosage and instructions provided by your healthcare professional. Avoid combining these medications with alcohol or other substances that can potentiate their effects and increase the risk of side effects. Inform your healthcare provider about any other medications, supplements, or herbal remedies you are taking, as they may interact with benzodiazepines. Certain medical conditions, such as liver or kidney disease, respiratory disorders, or a history of substance abuse, may also affect the choice and dosage of anxiolytic medications. Regular follow-up appointments with your healthcare provider are essential to monitor your response to treatment and adjust the medication as needed. It is important to communicate any concerns or changes in symptoms to your healthcare provider promptly. Conclusion: finding the right treatment for anxiety disorders. Alprazolam and Lorazepam are both effective anxiolytics commonly prescribed for anxiety disorders. While they belong to the same class of medications and work by enhancing the effects of GABA in the brain, they have slight differences in their pharmacokinetics and uses. The choice between Alprazolam and Lorazepam depends on various factors, including the specific type of anxiety disorder, individual patient characteristics, and treatment goals. It is crucial to work closely with a healthcare professional to determine the most appropriate medication and dosage for your needs. Remember, anxiolytics should be used as part of a comprehensive treatment plan that includes therapy and lifestyle modifications. Regular follow-up appointments with your healthcare provider are important to monitor your progress and make any necessary adjustments to your treatment. Managing anxiety disorders can be challenging, but with the right treatment approach, you can regain control of your life and experience improved well-being. Don't hesitate to reach out for help and explore the various options available to you.